You're listening to The Problem with Poverty, a podcast that helps bring awareness to the causes and consequences of poverty, as well as ways that we can overcome the problems with poverty together. Our company, Community Action Partnership of North Alabama, serves 28 counties in our beautiful state. According to 2019 estimates by the U.S. Census, Alabama was the seventh poorest state, with 15.5% of its residents living in poverty, as compared with a U.S. average of 11.1%. Our goal with this show is to highlight all of the opportunities that we and our partners have to help people overcome poverty as we focus on helping people, changing lives.
Welcome to the Problem with Poverty podcast. I'm your host, Holly Hicks. Today's guest is Edie Dugger. Edie is a center director at our Moulton Center in Lawrence County, Alabama, and she's here to discuss support for staff mental health in the event of trauma. Welcome, Edie.
Thank you for having me.
I want to offer quick statistics about substance abuse and mental health services. According to the Substance Abuse and Mental Health Services Administration, 61% of men and 51% of women report at least one traumatic event in their lifetime. So our first question for you is, not so much a question, but a lead-in.
Yes.
On November 14th of 2015, your life and your family's lives changed forever when your aunt, Kay Stevens, was murdered by her ex-husband at her place of business. Take us back to that dark day.
Yeah, that's definitely the day that everything I knew to be true changed. It was a Saturday morning. I'd slept in. When I finally did wake up, I had a text message from my aunt. She was telling me that her soon-to-be ex-husband had called her that night and told her that he was going to kill her, which over the course of the 18-month divorce proceedings had done many times. But that particular morning she asked me to look up on Match.com at his profile to get a most recent picture of him and his vehicle, if possible, to give to the neighborhood watch. She and my grandmother had just bought a house together. My grandmother's second husband, he had passed a few months earlier, so they were moving in together, had just bought a house, been a month. While I was on Match.com looking for this picture, I got a phone call from a family friend, and she had actually been driving by the corner bakery, which is across from the hospital. She was on her way to Point Mallard here in Decatur, and she was frantic. She was telling me something terrible has happened and that she wasn't sure who, but somebody was hurt very badly. She handed the phone, and she ended up handing the phone to my mother. And my mom was very distraught and was telling me, he did it, he shot her. And I just, at that point went into a state of shock. We got ready, went to the bakery. I called my sister on the way to let her know what was going on. We get there, there's police everywhere. Kay had already been transported to the hospital, and the police were there, doing what they do to secure the scene. And so then they transported her to Huntsville Hospital, where she eventually succumbed to her injuries. So that they took us up to a room to tell us, and that's really when the nightmare began. And everything in life, kind of has a point of before and after. And so for my family, that was definitely an event that everything moving forward was either before or after that event.
So this is your family's dividing line.
Yes. With it being a criminal investigation and none of us being with Kay when they transported her, it was necessary for a family member to actually even go back to the morgue and identify Kay. And I I chose to go with my mother because I did not want her to do that by herself. My grandmother was elderly. She was close to 90 at the time, and I just didn't think she could handle that. And so I went back with my mother to actually even identify Kay's body. But in some ways, that vision and that picture is comforting to me because she looked at peace. At the funeral, she did not look at peace, so that was more difficult to see. But yeah, there was a lot of things and events that were caused by that tragedy that I never imagined that I would have to take part in. So,
say more.
Well, you know, you learn a lot about people. You learn a lot about your family. My aunt had been married for 40 years. My entire life was spent with Kay and her ex-husband a lot of time because Kay didn't have her own children until, or her own child. She only had one daughter. I was 15 years old. And so I was her girl for all of my childhood and adolescence. I mean, for 9 years, I was the only grandchild, niece, everything in the family. So I might have been a little bit spoiled, but my dad says I was rotten. But yeah, so Kay is the one who, she taught me to paint. She taught me to cross stitch. We had gotten really close over those 18 months because her daughter did not live here. I was kind of her support person, walking through the divorce with her. We had gone on a couple of little trips together. She was doing embroidery at the bakery, and she was really wanting myself and my sister to help her with that side of things. And so I had gone on a conference with her for that. And, you know, everything that I envisioned growing old and life was going to be like within my family was immediately just erased. I just had no idea that someone that I had grown up with and loved, he was rough around the edges, but you never saw that coming. And so it's really difficult to kind of come to terms with not only losing my aunt, losing her in a very violent way, and then feeling a little betrayed and just a loss of trust of what you know to be true. And the family, you know, families, if they have issues within them, events like this can either bring them closer or it can drive them apart. And for a minute we were closer. And then the issues within the family began to create issues where a lot of us have not been able to reconcile. So, and then you go to trial, brings up a whole nother set of things. You look at years, unfortunately, of waiting for some kind of closure with your family, and within that time, a lot of reports are made because it was a very public situation. So there were a lot of people commenting on stories, and a lot of people, you know, the news calling, reaching out. You know, you turn on the TV and his mugshot pops up and you're not expecting it. You know, it was just a lot of continuous just remembering and bringing up those things that you try to put out of your mind, but you just can't. You just can't.
It sounds like for you, for those of us on the outside, once the news has given us the story, it's done for us.
Mm-hmm.
It's the part that comes after that lingers, that creates way more than most of us could understand.
Mm-hmm. You and I have talked before about this, but Kay's death was a result of what we feel is a domestic violence. And even though he had never hit her before, the one time he hit her was fatal. And so, we did purple ribbons, her church at the time did purple ribbons from the church where we had the service to the cemetery. And over time, a lot of those purple ribbons fell off. But there was one that was always there at a very, very busy intersection here in Decatur. And I typically passed it every time I came to central office. And for me, it was very poignant to think that even though that ribbon had been worn by weather and the elements and all of that, it was still there. It didn't look the same. It wasn't as big and full and vibrant, I guess is the word, but it was still there, even tattered and in pieces.
Very symbolic.
Yes. I took a lot from that to understanding my grief and my way of dealing with that. Because a lot of times when you're going through something like that, everybody, and even myself, was waiting for the day when I could say I was back to normal. But that doesn't happen like that. I mean, you get to a place, but it's never back to who you were before. Because every time you experience anything, good, bad, whatever, it really, it changes you and creates in you, that influence of that experience creates in you newness. And you have to kind of navigate that and figure that out. And the good things, like a birth of a baby or a wedding or something, those are joyous things. And no, you don't feel the guilt of carrying that joy. But when it comes to grief, there's a level of guilt, or I felt like there was a level of guilt of carrying that, continuing to carry that, still feeling that, And it took me a while to realize that was okay to carry that with me. But that ribbon, and I appreciate, Holly, you went, I came by and got you when I went to actually cut down that ribbon and finally let that grief down off of that pole. And I still have that ribbon.
We recorded that, didn't we?
Yeah. And I still have the ribbon. I almost brought it with me, but I didn't. But yeah, that ribbon to me is very symbolic of what it means to grieve and how it changes over time. But regardless, it's still there. It's still there. So grief is something that we all have to deal with eventually. But sometimes I feel like we can rationalize that. We see someone who's sick. We see someone, that has lived a full life. But then there are instances where grief hits you out of nowhere and you just feel like a piece of you is stolen. A piece of you is stolen. So,
at the time of the incident, you had been employed with Community Action for about 6 years.
Mm-hmm.
Talk about how the news of your aunt's murder was received by your colleagues and how your trauma was addressed in the workplace.
Mm-hmm. So I did pretty good for starting to work at like 18, didn't I? I mean, anyway. Grow old gracefully. Yes, I had been here for 6 years. I had I worked here at Central Office at the time. I was based here. And in the role that I had at that time, I had a lot of people up here that I, spent some time with. We even had a little lunch bunch kind of group that would go and have lunch together. That was something we all look forward to, and so that group really reached out to me, and in fact, on that day, because it was such a very public event, news immediately, and with social media. I mean, before a lot of family could be told, things were coming out on social media, and that was tough for some of the extended family. But my phone started blowing up with people trying to call me or text me or whatever, and I was just not in a state to be able to respond to anybody at that point. In fact, at one point, I just handed my phone to my husband, and I said, I can't with this right now. But luckily, they were all very understanding with that, and we got through the weekend. Before I actually came physically back to work, I got a phone call, to check on me. It became very business. I felt very much like we were walking through procedures. I was reminded of my 3 days of bereavement was what I had. And if you're not aware, with a criminal investigation, it's required that there be an autopsy, and so they can confirm, the cause of death. And so we weren't able to even have Kay's funeral. This happened on a Saturday. It was actually that next Friday before we were actually able to have our funeral. And so at the time, I was not concerned about how many days of bereavement I had. I just wanted to be with my family, and so that kind of hit me in a way that I didn't feel very supportive. But I mean, I do understand that there's a delicate balance between conducting business and then also showing that compassion. But at the time, my perception and the way that I received it was a little more procedural, a little more business than personal. But then again, when you're going through something like that, your emotions are very raw. And so it's very easy to take things as personal. And there were several times, there were a few things that I took as personal. I had another situation where I feel like the intent was to protect me. But in retrospect, it fed into my response to trauma, which would be not fight, flight, freeze, flight. I'm a flight. I go into my own little hole when I responded to trauma. I isolate, don't want to deal. And so I was given some advice to not really talk about what had happened or what was going on with my family at work, that it was, with it being in the news and everything, everyone was very curious. And so it would be in my best interest not to share so much with that. And again, I took that very deeply, and probably not even what was meant by it was for me to shut down, but that's exactly what I did. And I even had a member of leadership one time tell me that my office here at Central Office was the loneliest place in the building. And that just kind of hit me. I was like, whoa,
That is not a compliment.
It didn't feel good. And I'd really, to be honest with you, at that time, didn't realize how much I needed people. I'm sure there's people listening to this going, what, this crazy lady? I mean, they've seen me in service or whatever, and I'm not probably seen as an introvert in a lot of ways, but at that time I was very much in myself, and introverted, and more than likely that, in retrospect, that was a protecting factor of, trying to protect myself, withdrawing myself from really much of anybody or anything. So, yeah.
Well, how did your experience dealing with personal trauma and navigating that trauma in the workplace affect your overall well-being and your mental health in particular?
Well, again, I went into my own little cave. I just, became very distrusting, just because of my, the whole situation was just, I didn't know what to think anymore, right? Everything I thought to be true didn't feel true anymore. And so I began to take a lot of things very personal, which I had a very nice colleague basically kick me in the tail and tell me, nobody can do anything to you that you don't let them. And that was probably the first time that I thought, oh man, I have a responsibility in this. I have a responsibility in how I am allowing the things around me to have power to make me unhappy, to make me think that, question everything I do, question everybody's intentions when they, come to talk to me about something. I take a lot of pride in my job, and there were questions about I felt that the quality of my work was being questioned. And instead of being able to have that conversation, I was just in a mental state of fight. And so, I lashed out and began what appeared to be a professional spiral, but it was all part of my journey, and to get to where I'm at now. And so, but I've had to reconcile a lot of my own emotions and my own role in my mental health and the way that it manifests outside. The choices I was making, the people I was not trusting. Just I was like walking around waiting for the ball to fall, and in some way feel like I kind of predestined myself for that in actually thinking that you put enough energy into something, it starts to feel very true and very real. And so that's where I got to within my professional career here, and began to not be very receptive to working with others. Just, it was like me against the world feeling a lot of times.
As you've already heard, Edie's story is powerful and deserves to be told. Stay tuned to part 2 of Edie's perspective on trauma and what life is like after trauma.